The White House is facing backlash this morning after incoming press secretary chuckled when asked who was in charge of fixing the severe baby formula shortage. Listen to this.
This is an urgent issue that the FDA, as you all know, and the White House is working 24/7 to address.
Who's running point on the formula issue at the White House? You mentioned the White House is involved.
At the White House, I don't know. I can find out for you and get you a person who's running point, but I don't have a person in it.
Well, the FDA now says it will allow some baby formula products to be released from the closed Michigan plant on a, quote, case-by-case basis. But the plant says it will still take 10 weeks to get the formula on shelves. So here to react is the former FDA Associate Commissioner, Peter Pitts. Good morning to you, Peter.
Good morning.
Good morning. So is it safe to get products from this plant? Because the plant had to be shut down. Tell us what they found, what you guys found, the FDA found when they went in.
Well, the FDA got a tip-off from consumer complaints. 4 babies were ill from bacteria, 2 died, unfortunately, so it's a real tragedy. But the FDA hasn't been able to find bacteria in the Abbott plant product, but what they did find was absolutely essential to close the plant down. Lax safety protocols, water on the floor. They were keeping information from the FDA, so whether or not the product led to these deaths, that plant needed to be shut down. The FDA has been 24/7 on site since February with Abbott to get this plant back online.
It takes that long to clean it up?
That's actually fast, to get these complicated pieces of machinery back online. And even though the plants aren't completely remediated, they still have to update manuals and do things that are not related to manufacturing. The FDA is going to allow Abbott to go back online for the 3 products of baby formula that it manufactures.
You call this a consolidated industry. You said it's like a game of Jenga. If you pull one piece out, the whole place collapses. We didn't know. I was thinking there were lots of different factories, lots of different companies that produce baby formula, but one factory is closed down and it affects this many families.
Right, well,
why is that?
Well, this factory was shut down because of lax safety. Had to be shut down full stop. But there could be an earthquake. There could be a storm. There could be a terrorist attack. So what we need to do is recognize that in these various industries that are consolidated, whether it's baby formula or sterile injectables, which is on the drug side of the FDA, there needs to be a strategy about what happens if a major manufacturer goes offline and there isn't. The FDA went in there in February, but what the FDA didn't do was say to parents, there might be some spot shortages here, be aware of that, be prepared, stock up. They waited for parents to go to the market, and all of a sudden the shelves are empty. And when you have a young child, you're already on edge.
Quiet?
That was a mistake. I think they might have said, well, we don't want to cause panic, if they thought about it at all.
All right, so the problem is here. How do we fix it?
What we need to do is to give the FDA more resources to do more robust and regular inspections, because when you don't inspect a factory on a routine basis, companies get lax. Doing things to standard is expensive, but there's no alternative. So when Congress holds these hearings, they need to say, we need to give FDA more money for more robust inspections of these food factories, but also the FDA needs to be empowered to plan for drug shortages in these industries that are consolidated on the food side and on the drug side.
All right, so whose fault is this?
Well, the shortage is Abbott's fault, plain and simple. Their plant was out of sync. It was not safe. The FDA had to shut it down, period. They made the mistake.
What can Congress do?
Congress can, one, I think, name and shame Abbott for not doing the right thing, for not running a safe facility. Tell FDA to develop strategic plans for consolidated industries, give them more money for food plant inspections, and restore faith in the eyes of the American public.
Okay, Peter, thank you so much for coming on with us today.
My pleasure.
So many people are concerned about this story.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.